Hi, everyone. Thank you for joining us today for this DPC Learnings live stream. I'm Chelsea Yost, the sales lead here at Hint, and with me today are Dr. Kyle Rickner, one of the owners and founders of Primary Health Partners, and Rocco Wicks, CEO at PHP. And today we're here to talk about how Primary Health Partners has continued to accelerate the growth and adoption of DPC through working with employers. Rocco, I'd love for you to start out. Can you tell us a little bit more about yourself and who Primary Health Partners is and your current scale and scope?
Yes, no, I'd love to do that. So last year, 2022, was a very good year for Primary Health Partners. We started the year with 4 clinics. We ended the year with 6 clinics. So we added 2 clinics throughout the year. We started with roughly 6,800 members, and we ended the year with 8,500 members. So we had about a 25% growth with our members. We also, if you look at employer groups specifically, we started 2022 with 67 employer groups that we supported. We ended 2022 with 106 employer groups. So we added 39 groups that we work with, so a 58% growth with that metric. So if you look at 2022, it was a very good year for Primary Health Partners.
Awesome. And Dr. Rickner, can you tell us a little bit more about yourself and how you started PHP in the early days?
Well, sure, and I'll try to keep it brief. I love to talk about it, but I was one of those frustrated primary care doctors employed by a health system. And my partner, Dr. Robert Lockwood, and I actually attended an AAFP conference in Washington, D.C. in 2014. And that was where we first heard about this weird little group of doctors that were doing this thing called direct primary care. But it immediately clicked for us, and we just saw it as a solution in so many ways. And so we actually committed while we were at that conference, we're going to do this. And then at that time, the movement was really in its infancy, and getting a lot of information was not easy. So we gathered what information we could about from those that were doing it already, and then tried to form best practices. And early on, from having patients in our own practices that were business owners, we were very aware of the pain and tension that they were living in with the costs of their health coverage for their employees rising every year. And so one of the true pillars that we wanted to start Primary Health Partners on was making a difference in our community by coming alongside employers. And honestly, we had no idea how we would do that at that time. We knew it could work, we just didn't know how it would work. And so along with really changing the patient experience and changing the physician experience, those became our 3 pillars. And with those, we launched in January of 2016.
Wow. And when you started in 2016, did you start working with employers from the very beginning?
You know, our first employer was an interesting story. The owner of the business was a patient of mine, and they had 22 employees. And in the second month we were open, he just thought this was the greatest thing. And he said, I want to offer this to my employees. They had no health plan. And so he had us come to his place of business. There was myself, Dr. Lockwood, and the 3 staff people we had. The 5 of us went down one evening, and we talked to the group of 22 and stayed there on site with our laptops and signed everybody up. And so that was our first experience with doing it. And it really just started out, I think, like it does for a lot of people, with small little companies that don't have a health plan. It's a very simple implementation. It really wasn't until as we moved towards 2018, late 17, early 18, that we were able to start considering working with a little bit larger employers after we had opened our second location.
Awesome. And as you were starting to work with employers, can you tell us a little bit more about the challenges that you were facing and how do you overcome them?
Yeah, so I think you don't know what you don't know. And as we started, we started realizing there's layers to this that we're just not really familiar with. And one of the smartest things we did early on was we hired a lady by the name of Sharon Hodnett that had years of HR experience in working with self-funded plans. And so she was a great resource and tool for Dr. Lockwood and myself to begin to learn a lot about the layers and complications that were involved. And we realized that most of the consumers or purchasers of plans, the employers themselves, most of them didn't really know much. And so they were writing checks and spending money every year, and they just felt helpless, like they didn't know what else to do. So it really, those challenges were more educational and overcoming, and the learning curve being very steep. And I don't know why, it just really excited me early on. I just saw this frontier. It's like, this is where most Americans get their health care. And if we want to make a real difference and a real impact, we got to learn how to play in that field and make DPC a relevant player in that field. And we the more we learn, the more we realize this is a very large task. And at that time, just four plus years ago, it was still a very foreign concept to a lot of companies. So the challenge was having the conversations, so our own personal education, but then educating the employer, the consumer on that side. It's a large chasm. And once it made sense to me, I thought it would make sense to them, but I realized that it often takes several steps to bring them along that educational curve. But then once they get it, they get it. And one of the things we're proud of, and I'm sure this is the case for a lot of DPCs, Rocco gave you some numbers of employers, but we've actually never lost one. And I think because once they experience it and realize, they're like, oh gosh, we're not changing this. So that's been an exciting part of this.
Wow, that is definitely impressive to have never lost an employer. That's incredible. So one other question for you, Dr. Rickner. Can you tell us a little bit about when you started working with Hint and how did that play into your growth?
Yeah, so, it's one of those where we felt like we've kind of grown up with Hint a little bit. When we realized that we were going to go multi-site and we were going to start working with essentially a different payer source than just the patient themselves, we realized that sort of payment and revenue management was going to be a big piece of what we needed. And that was Hint's motivation early on. And so they made it a lot easier. You guys came alongside us and really helped us with assignment of revenue, management of revenue, and allowed us to properly attribute revenue as we started having multi-site and multi-physician, and then it evolved into allowing us to work with affiliate physicians, and Hint became a revenue cycle management for those affiliates and allowed the payment cycle for those affiliates to be easier too. So, and I think as we've gone through, we've seen that what seems like a really good way of doing things, we later learn, hey, there's a better way. And I've enjoyed that both of us are motivated to find the best, most efficient way possible to take care of these employers. And that's what we've seen is just really a growing up and a maturing of both of what we do and doing it together for the good of the businesses that we serve.
Awesome. And I know you touched on there a little bit about how you're working with affiliate physicians and how Hint has helped you to kind of streamline the operations around that. For those on this live stream who might not be very familiar with the concept of a network or the affiliate network, can you talk a little bit more about that?
Yeah, so that in and of itself has evolved. We were very blessed to get a large employer group that wanted us to take care of them. And our idea was that we would take care of the lives that they had locally here in the Oklahoma City metro area. And they said, no, we want you to do it for all of our lives. And that they had lives in 11 other states. And so we did a very manual process of finding affiliates. But when it came down time to help manage the payment attribution and assignment for those affiliates, that's where Hint played a role. And so now fast forward a couple of years, and as we're working on other contracts like that now with Hint Connect, basically we're going to be stepping out on a limb with Hint and letting them manage the affiliates, because what we learned, as other DPC providers have learned that have done this, that managing an affiliate network is a lot of work. And frankly, I think all of us underestimate the amount of work and the amount of expense that takes. And so we're so excited that the capabilities that Hint has, they've looked to grow those capabilities to meet the needs that we have, so that we can respond to larger employers.
Awesome. And as you were talking a little bit about Hint Connect, Rocco, can you tell us a little bit more about how you see Hint Connect playing and supporting your future growth plans?
I think it's going to be invaluable. Like I said, we've had success in adding on employer groups. So one of the first questions that employer groups have to us is, can you cover all of our lives that we have, all of our employees? And many times we're talking to groups that are outside of the Oklahoma City metro area. I mentioned at the beginning, so we have 6 clinics. We have 5 in the Oklahoma City metro area, and we have 1 in Ardmore, Oklahoma. We have plans for expansion, but we're still not all over even the state of Oklahoma. So it becomes tough when we talk to employers that are definitely outside of the state of Oklahoma. And that's really where our relationship is going to come together, and the partnership is going to help us grow. Because as Dr. Rickner said, it's a lot of time, resources, manpower to do the vetting and to make sure that all of the other clinics that we're talking to can provide everything that we can. And so Hint Connect is taking that off our plate.
Great. And now, one thing I hear a lot as I talk to a lot of practices just starting out, they can sometimes be just intimidated by working with employers, or they can find it a bit slow as they're getting started. Can you tell us a little bit more about what's helped make you successful in selling to employers?
So I would say one of the things that really helped us last year is we started getting the data back. So in other words, we've worked with some employer groups for a couple of years, and they finally could give us actual numbers. So we could put that, when we would go out to talk to potential other groups that weren't a partner of ours yet, we could say, here's what we've done for this group, here's what we've done for this group, and assign actual values. So one of our larger groups, we have a percentage of what we've cut down. If you look at emergency room visits, if you look at urgent care visits, if you look at the number of times one of their employees had to be referred to a specialist, we actually have those numbers now that we can go out and talk to other employer groups about and give them sort of that real world data. And that goes a long ways when you're talking to a potential employer group, because now they understand it, and we can assign actual dollar values to how much we can save.
Awesome. And by the way, just a reminder for everyone watching, please feel free to drop any comments or questions that you have, and we'll go ahead and get to those toward the end of our call. But last question for both Dr. Rickner and for Rocco. What's one piece of advice that you'd give to practices that are just starting to work with these employer groups?
Yeah, I think Rocco and I were talking earlier, and I think that being successful with employer groups really requires a commitment to it. It is another layer of complication and complexity that you have to be willing to tackle. I was recently speaking with one of our affiliates that's helping us with a client in their area that's part of a health plan that originates out of Oklahoma, and this affiliate was in another state. And we had a conversation around, why cannot that local entity not just pay them? And when you start to become part of a benefit plan to where it is built into the benefits, which is really what we want, but there's some complexity to getting it there and then to executing in the way. And so it can be a little bit confusing. So I think having a commitment to it is very important. The second thing I would say is you have the ability to work with employers that don't necessarily have health plans, and the complexity goes way down. And there's a lot of that market out there. There's a lot in the service industry that they just need something. And so there's a lot of low-hanging fruit that can go out there and be gotten. So I don't think it's necessarily that every DPC wants to work with employers, and that is totally fine. And I tell people our journey has been our journey. And I think that that's true of every DPC. And we're all aware of other ones that have made a commitment to work with employers. And I think once you're in it, you realize, wow, there's a lot to this. It requires a lot of management. And so you sort of have to have a level of commitment if you're willing to do it. So I would just say that and realize it may not be as simple as you think, but it's very doable. So that would be some words that I would have. So I'll leave others up to you, Rocco.
No, I think you summed it up very well. It's every direct primary care clinic will do things a little bit differently. So everyone's journey is different.
Great. And Dr. Rickner, you mentioned that in working with employers with health plans, you have some that have health plans, some that don't. But can you tell us a little bit about how you handle in-network referrals?
Well, so when you're working with self-funded employers, that means they may have had some degree of customization of their plan to meet their needs. And that can go all the way from a fully customized plan with direct contracting in multiple areas to kind of a canned, pre-planned plan that they just accepted all of the components. And so one of the things that we talk to employers about is we tell them we make it our business to know your business. And so it actually highlights one of our current challenges. So when we have this many plans that we work with, how do we make sure that we optimize the use of that plan, that we do the steerage of the patients in the way that will benefit the patient the most and be friendly to the plan? And I think that takes a lot of work and commitment. And we're actually discussing that within our walls. What does that look like moving forward? Does our current process scale enough to be able to handle it? And so I think referrals are a huge piece of every plan, and knowing obviously who you can send them to and through what mechanism. There's a lot of vendors that are actually trying to serve a purpose in that gap. For right now, we take it upon ourselves to make sure that we close the referral loops as a customer service action towards our employers. The best thing that we did 2 years ago was we relieved our providers of the pressure of knowing all the plans and where people should be. And it was getting to be too much. So we make sure that there are certain people that know that and handle those referrals. And I think as we work with more employers, we're going to have to actually raise our game there and sort of have a little bit more of a sophisticated process to handle that, because it does get complex.
Now, when you're working with employers that don't have any health plans associated, do you have any direct pay specialists that you work with to send them to instead?
So we developed a lot of those relationships early on when we started PHP. We were working with almost exclusively retail patients, and probably about 30% of our patients early on had no insurance. So we were very willing to explore and leverage the local healthcare economy to find the best deal possible. And so as we started that process in month one, even, and we just grew it. And so we grew some relationships around that we could leverage. So we did some direct contracting on behalf of our patients. And we've actually continued to scale that. We actually did a direct contracting deal with a local hospital system to where services can be rendered to our patients under this agreement, and it just makes everything clearer. So one thing about primary care physicians is I think we consistently undervalue ourselves and the services that we provide. And I think that we are a powerful advocate for the patient and also for an employer plan, but we need to be willing to step in the gap and almost act like a case manager. And by doing that, we really can get some good deals and create some healthcare shortcuts and pathways that were not there before. We're just not okay with the status quo, and we don't want to be in a box. We want to blow up the box and do things different and better, because we all know we're living in such a broken system.
All right. And then we have a question from an audience member, from Brian Gagney. He asks, do either physician have any data on the % of eligible lives adhering to preventative screenings, i.e. colonoscopy, mammograms, immunizations, et cetera?
Yeah, so on that one, we track it within employer groups. And Rocco mentioned data in terms of cost outcome data, but we are now actively working on what kind of health metrics, just like Brian mentioned here, that we can extract this data out ourselves and make sure that we're doing a good job, and not just a good job, an excellent job. Because I think in DPC, we do this better than in any other environment because we have the time, and it's just a matter of proving it. So we worked with a third-party vendor early on to try to gather some of this data about what we're doing. And, that just didn't go well. So I decided last year, we're just going to do this for ourselves. And so we have a person that's dedicated to help extracting this type of data.
Awesome. And then there's a second part to this question too. Have either you or Hint created any cost benefit analysis templates to show the financial benefits of moving to DPC?
There's unfortunately no. There's a lot of variables associated with the healthcare system that almost make that somewhat impossible. That's where we rely on the groups that we've partnered with for the last couple of years that are now giving us the data. So in other words, we have an employer group that came to us and told us that we lowered their claims ratio to 73%. Which when you think about it, you say, well, 73%, that's a high number. But what that is that's actually a loss ratio. And any plan run under 85% is considered a well-run plan. So they were excited when they came to us and told us that their claims ratio was 73%. We had another employer group that actually did assign a value to, say, emergency room visits and urgent care visits. And so they assigned a value of every time one of their employees went to the emergency room, it cost them $110. So then they looked at the data over the year and how much we cut that down. And then they assigned that 110 multiplied by how much we cut that down. And so that's where they came up to us with the savings. They came up to us with an overall savings of $240,000 that we saved them. So a lot of this right now, we're still in its infancy of coming up with templates. A lot of what we're giving, we're going out and talking to potential employer groups is the data we've been given from the groups that we work with.
I will add to that as I said, we often undervalue ourselves. The way to flip that is that we actually assign a value to everything that we do. So we're actually working in-house to do that from the ground up right now, so that when we say this is what we deliver at this cost, this is the value, or this is what you receive in return, and we can give that to each employer. The one thing that's been missing, where there's been a lot of good case studies in DPC, not truly anecdotal, but really just small case studies. And so what we're going to try to do is aggregate a number of employers over the next 6 months from our previous 2 years, and do this benefit cost analysis. Because the other thing that's difficult on these case studies is every employer group is different. They have a different demographic. They have different working environments. They're in a different geography. And so it's really hard to extrapolate and say, well, we did this for this group, so that's exactly what it'll be for all of them. So we're trying to aggregate our top 5 employers actually, and look at all of them as one big group and show that cost benefit analysis, because we just don't feel like it's been done on a scale that has been meaningful yet to put out there to all employers.
Great. And then I know right now Hint currently doesn't have, to answer that question too, Hint does not currently have any kind of templates that we have to be able to show that financial benefits, for many of the same reasons that Dr. Rickner mentioned, that there's a lot of variations across different employer groups, what they're looking for, and how you can actually aggregate that data to measure it. However, we do know that Milliman is about to kick off a study that'll actually help to look into this.
Mm-hmm. There's also a lot of interest. The AFP is actually doing a longitudinal study, and they're very interested in showing some of this as well. So there's a lot of work going into this. There's some needs that we know we have. And so I think there's great news to come even in the next 12 months.
Great. And then we have another, just more of a comment, but there are a lot of as Brian points out, there are many point solutions that practices can eliminate. It's like navigation, chronic condition management, and more of that.
Right. That's one of the beauties of the direct primary care model, is that because of the time that each provider has with their member, with their patient, it's much more effective at managing chronic conditions. So I mentioned earlier that one of our employer groups showed us that we drastically cut down the number of times that their employees went to specialists. It's because their provider can spend the time with them and manage that chronic condition so much more effectively.
Definitely. And then kind of switching topics a little bit, since one of the things that we really want to make sure we talked about today is growth. So I know you mentioned at the top of the live stream that you're looking to expand your locations. So can you tell us a little bit more, as you're expanding your offices, how do you approach that?
So it's multi-pronged. So like I said, we started 2022 with 4 clinics. We ended the year with 6. In the first 4 or 5 months of this year, we're going to add 3 more. So we'll go to 9. But it's one of those things where we have to find a location, a physical location. We have to find a provider. And then we have to kind of marry those 2 up so they meet at the same time. Then also what we want to do is when we bring a provider on, we want to have existing members for them to walk in the door with, so they're not starting at 0. So one of the things we've had luck at and we're getting better at and more effective is getting the three of those to line up to where we feel very, very good about being able to do that and open these 3 clinics at a cost-effective way where we get the location at a good cost and also bring the provider on with an existing panel.
Awesome. And then any last questions from the audience before we get ready to wrap up? All right. And then I guess any last thoughts then before we wrap it up from Dr. Rickner or Rocco?
Well, I would just like to be really encouraging. I want to see DPC grow and expand. I don't think we're a different model of primary care. I think we're a better model of primary care. And so I think being able to be effective in the employer space is truly key to scaling direct primary care. So if there's any doctors out there that are considering this, thinking about it, I really want to encourage it because I want us to be able to make a true difference. And I also just want to give a shout out to DPC doctors, just in our experience of coming together to serve the needs of an employer across state lines, and being able to do that in a really timely fashion, being willing to network together. That just can't be done in any other setting. And so we have something very special. And I think our impact can be massive, and we're just getting started. So I really want to encourage those out there to be willing to work together with others, and just be willing to realize that we may have to leverage the payment sources or the means by which people get their health benefits. We will have to be willing to work with them to make the impact of DPC as broad as possible.
Great. Well, thank you both so much for your time today and sharing your expertise about how to adopt and grow through working with employers. And thank you to everyone who attended today and your great questions. Take care, everyone.
Thank you.
Thank you.